Hello, I'm Ben and I'm an acupuncturist. When people find out what I do for a living, there's probably two questions that are asked most commonly. Firstly, does it work? Secondly, how does it work? So, in answer to the first question, does it work? Yes, quite simply. There's loads of brilliant evidence, loads of great research that suggests acupuncture is a brilliant option for managing or solving a variety of different conditions, whether that be on its own or alongside other therapies. Does it work for everybody? Well, much like anything, there's variations in people's responses to acupuncture. It depends what you're coming in for, it depends on your kind of lifestyle habits and what's going on in your own life. I often give people the example of painkillers or antibiotics. You might be in pain for some reason, and anti-inflammatories are going to work much better than paracetamol. And it's the same with different therapies like this. We've got to find the right approach. And even within acupuncture, there's many different approaches of how we can treat something. As for the second question, how does acupuncture work? That's a bit more tricky to answer. We do have quite a lot of great information and great research on what acupuncture is doing to the body. For instance, from a biomedical point of view, we have evidence that states that acupuncture is great at reducing inflammation, and it does that by providing a blood supply to the area to clear away any waste products that might be related to inflammation, and it also regulates the cytokines in your body that are responsible for inflammation as well. Similarly, we've got a response from the nervous system. We know that acupuncture stimulates endorphins and stimulates neurotransmitters, which are feel-good hormones. We know that it has an effect on the parasympathetic nervous system, which is responsible for our rest and digest function, as opposed to the sympathetic nervous system, which is fight or flight. So it has a big impact on stress and our response to stress as well. We know that it has a huge impact on pain, not only manually sorting out, correcting any tissue dysfunction, any joint issues, any issues with inflammation, but we've seen via MRI that when acupuncture needles are inserted, the pain matrix that deals with pain in our brains actually gets deactivated, which is quite a powerful example of how acupuncture works. Now, when it comes to pain, when it comes to inflammation and response from our nervous system, these three things are hugely related to a massive variety of conditions. So if we know that acupuncture can improve these things within our body, then we know it's going to have a great impact for a massive range of illnesses and conditions. So how does it do these things? That's a bit more of a mystery. Why putting particular needles into particular areas of the body actually has this impact on us is not quite as well known. I think it comes down to the amount of research, the amount of money that goes into research into these things. But we do know that it does these things, and for most people, that's enough, to say that these changes can happen with acupuncture. Another way that we can look at how acupuncture works is by using the ancient Chinese medicine theory. Now, we're talking about things like concepts of qi, we're talking about the meridians and the channel pathway within our bodies. It can be quite tricky to get your head around these things. It can be a difficult thing to believe, I suppose, that we have this life force, this qi that runs through our body that's responsible for all of these processes. I like to think of it more as a metaphor, as a way of describing these processes within the bodies. You've got to think thousands of years ago, they didn't have the same understanding as we do now about the bodies. So they used the terms, they used the descriptions as best they could to describe what's going on. For instance, there's a type of qi called wei qi, which is a protective layer of qi across the body that prevents pathogens from entering the body. Now, when you read into this, they're basically describing the immune system. It's as simple as that. But when we start bringing in this life force, this qi that's protecting us against these kind of evil pathogens, it starts to get a little less believable. I think we just need to kind of look at it slightly differently and trust that we do have a better understanding now of how acupuncture works to promote wellness, essentially. One of the issues that you have is if we don't understand something, if we're talking about concepts that are immeasurable, we can't touch them, we can't feel them, it's very easy to kind of throw acupuncture and acupuncture theory into this, the idea of placebo and the placebo effect and what impact that has on our bodies in getting better essentially without anything happening. Now, I've got quite different opinions on that. As I think the idea of placebo is fascinating, it's brilliant. The idea that our bodies can make themselves better, whether they be tricked or whether it's through things like acupuncture making you feel like you should be getting better. I'm sure there is an element of that, but there's also lots of evidence to say that what we do has tangible effects on the body. The reason why I bring some of these things up is that I've done quite a lot of writing recently on a blog on my website, which you can visit at benelliot.co.uk/blog. I've talked about qi and the functions of qi and how we can kind of try and best get our heads around that. There's lots of articles on particular conditions and how Chinese medicine theory links into the biomedical theory for those particular things. So I've talked about inflammation, talked about other conditions in isolation, as well as talking about the more exterior of the body, so muscles and bones, and how muscle tension in particular areas can create certain conditions. It's really helpful information, I think, whether you're a student studying acupuncture or a similar therapy, whether you're a patient that's interested in these concepts and want to know more about how it works and what the theory is, and also anyone that just has a general interest in my personal points of view on these things, because they will differ from people to people. So if you are interested in that, go and check out some of the blog posts. The blog is benelliot.co.uk/blog. Thank you very much.